hopefully. So welcome everyone to our webinar this afternoon on building mentally healthier councils and introducing our new framework. I'm Shazana, I'm the network lead and I'm hosting today's event, and it's good to see so many of you here today as well. So thanks for taking the time out to join us. I'm delighted to be welcoming Katie Dealey and Lucy Chick from Worcestershire County Council, and Laura Hodgson and Karen Walker from Leeds City Council, who are going to be sharing their insights into implementing our new framework. We're also joined by Kadra Abdunasir from Centre for Mental Health, who will be sharing highlights of the big mental health report, which was produced by Mind, and the Centre for Mental Health supported this, and that was out last week. Andy Bell, CEO for Centre for Mental Health, will also be joining us a little later and closing with his reflections. So before I hand over to our speakers, I'm just going to give you a bit of an overview of the new framework that we have developed. And this is based on the feedback that you gave us about what councils thought were the most relevant criteria to support wellbeing in your communities. So I'm just going to share my screen. Just bear with me 1 second. Can you all see that?
Yep.
Brilliant. Thank you. Right. All the techie stuff takes so long. Right, so we do have quite a few slides to share today, but don't worry about noting them, as I'll be sharing these all afterwards as well. So firstly, thanks to everyone who responded to our survey, which we sent out last year. We had some great insights about what criteria you think is priority in supporting better mental health in your areas, and also what policies and initiatives you are most proud of. We've already produced the webpage of resources with all these, which we shared earlier on this year, and we've now produced a framework. So the aim of our new framework is to embed mental health as a core priority in all council strategies, policies and operations, which will help in creating a mentally healthy environment for both residents and the workforce. The criteria selected has been organised into 5 key areas, which align with the key social determinants of mental health, and the framework is a 10-point checklist of approaches to embed mental health policies and initiatives. Each point outlines practical steps that you can take to promote well-being and reduce risk factors that harm mental health. These are all easy to demonstrate, won't be costly to councils, well, not too costly to councils, and have been proven to show that they will improve mental health. So these are the 5 key areas that were identified, but I'm not going to go through each one because we're going to be covering them in the next slides anyway. So on taking accountability and prioritising mental health in all policies, this can be done by demonstrating clear leadership and accountability through embedding a mental health in all policies approach and applying a bespoke mental health policy test. This could be by designating either an elected member or a public health officer as a named mental health champion to drive and oversee implementation. Could also be done by publishing a recent mental health needs assessment and strategy, which has been co-produced with communities within the past 5 years to ensure actions reflect lived experience and current priorities. Now, both these toolkits are on the Centre for Mental Health website, and I'll be sharing those a little later as well. So on the second key area, on tackling poverty and reducing financial inequality to protect mental health, number 3 on the checklist is adopting the Living Wage Foundation accreditation to provide a decent standard of living for everyone. And number 4 is producing an anti-poverty strategy, which includes a social value procurement strategy and provision of free advice on finances, benefits and employment. And on improving and creating mentally healthy environments, we can do this by ensuring planning policies actively promote the development of adequate, affordable and accessible homes. Number 6, adopting planning policies that expand green play and community spaces while driving sustainable town centre renewal to enhance well-being. We've also included a focus on prevention and early intervention with supporting a mentally healthier start in life, and this can be done by providing high quality free parenting courses, resources through the Best Start Family Hubs programme, giving every child the best start in life. It could be done by providing dedicated funding for early support mental health hubs for children and young people, and thus promoting timely access to care and support. And number 9 on the checklist is championing a whole school and college approach to mental health and wellbeing, which supports the development and delivery of integrated strategies across educational settings. Our final key area is on equity and delivering equitable services and support that protect and promote everyone's mental health. And you can do this by signing up to the Prevention Concordat for Better Mental Health programme to take a prevention-focused approach to improving the public's mental health and reducing health inequalities. So I think somebody's got their we can hear somebody in the background. Sorry, do you mind putting yourselves on mute? Sorry, thank you. So we invited councils to review the checklist and provide insights into the framework's application and to understand how the items are making a difference to mental health in their area. So we have 2 councils joined us today to share their insights into testing the framework and feedback on how it aligns with their initiatives. So our next steps will then be to finalise the framework based on the feedback from today that we have throughout the webinar and from the testing councils, launch this early into 2026 and engage with councils on implementing the framework with a view to review progress later in the year. So part of engaging with councils will be to identify any items on the checklists that they're not currently implementing, explore whether they would be interested in developing these items and initiatives over the next year and see how best we can support them to do that. So thank you. I'm going to stop sharing. There we go. And I'm going to hand over to Lucy and Katie from Worcestershire County Council to present their insights. So Katie and Lucy, if you're ready, over to you.
Thank you.
Thank you.
So let me just sort the presentation out. Can everybody see that okay?
Yes.
Yeah, but I can't see any hands or anything in the air, so if anybody does have any questions or if anybody wants to jump in, just jump in. So hi everyone, my name's Katie, so I'm a senior public health practitioner working in Worcestershire County Council's public health team. I lead on adult health improvement, and I'm joined today by my colleague Lucy, who is a head of service for the public health team, and actually did a lot of the work that kind of we're going to be talking about today. So before we start, I just want to give a bit of kind of an overview of Worcestershire as a county and kind of how we're set up. We are a 2-tier system, so we're the county council, and then we also work with 6 district councils within the county. We have a population, so we look after about 600,000 residents with an urban-rural mix. So we do have quite a large rural area, which obviously brings with it challenges such as social isolation and loneliness, which has been some of the focus of the work that we've done around mental health and wellbeing. So we're going to talk through some of our reflections really of going through the framework and in particular the checklist. So we decided to go through RAG rating. So we did a bit of a systematic RAG rating process around the checklist. We found it really useful actually as a reference point to understand how we're supporting residents and the workforce to improve their mental well-being. And we RAG rated based on obviously sort of green, amber, red. So green, we felt that we fully met the requirements of the checklist, or that we were implementing good systems and practices to relevant to the checklist. Amber, we felt that we were making some progress, but there could be some improvements made, and then we've put action points in place to make those improvements. And red, we didn't feel like we were making any progress on any points within that checklist. Unfortunately, we didn't feel like we weren't making any progress, which was a good starting point. So we're going to go through some examples within the checklist that we demonstrated some of the evidence and information against the criteria. So I'm going to hand over to Lucy, who's going to do the first example, and then she'll hand back to me in a little while. So Lucy.
Thanks, Katie. Good afternoon, everybody. As Katie said, I'm Lucy. I'm from the public health team at Worcestershire County Council. And I think when we're looking at this framework, one of the things that really embeds it for us or sort of really helps us in thankfully not having any red on that checklist that Katie just went through there, is centred around our joint local health and wellbeing board strategy. So this is a sort of a brief overview of our strategies you can see on the side here. So we developed this back in 2022, which already feels like a lifetime ago, but it's actually not too far. But this made a real step change for us locally in terms of how we focused on mental health and mental health and policies, because we really centred our policy around good mental health and wellbeing. So that was our one priority for our health and wellbeing board strategy. And ordinarily we'd had many strategies in the past that had lots of different targets and lots of different things for us to look at, but we really wanted to centre this one around one thing, and that one thing was good mental health. And by looking at the date, you can see that this came after one of the biggest impacts on mental health that we've seen across the UK was COVID-19 impact. So after COVID-19, we did some research and some work into our communities and tried to understand the impact of those communities. So we did some focused research and ethnography studies and other bits and pieces. And we also did a public consultation around the fact that we were developing our strategy that coincided with COVID. And we had 85% agreement that absolutely we should be focusing around good mental health and wellbeing. So it gave us a really strong foundation that we have since built off, and also gives us the foundation for being able to respond to the checklist that's been put forward. And really this was about embedding this into our practice and how we run our health wellbeing board or how we work with our communities. And we are so grateful that we got a lot of really strong engagement at that time, at a time when people were incredibly interested about their health and well-being and how much it had been affected by COVID. So if I go into the first sort of example that we've got, and that really is have a mental health needs assessment strategy, needs assessment and strategy co-produced with the community. So straight away we know we've got a really strong foundation for that because of what we've done, and much of this fits within the scope of the public health teams and what you would expect to have a needs assessment, expect to have a focused strategy, and we're very grateful that ours absolutely links to what this checklist is looking for. And we were really lucky that we got such good engagement, and that may have been off the back of COVID-19, but we opened a 12-week consultation with the public. We had over 1,600 responses to that consultation from both members of the public and the community, which really helped us ensure that we were doing what was being reflected by the community needs. Now, an interesting thing that we did, which is arguably the wrong way round, but after we developed our strategy, we then undertook a needs assessment. And essentially the needs assessment for us ticked the box to say, yeah, everything that your public told you is what we're also finding in our data. So it was able to sort of back up our thinking rather than necessarily lead our thinking. But it was really helpful to go through that process to get the real buy-in from the system. And I think you can see there that the requirements we've put down, how we think we meet that, and as I've sort of already run through the strategy, we think that that's there. But because we have that hook, I think it's easy for us to necessarily demonstrate that. I think if you haven't got that governance hook or the health wellbeing board strategy or something to centre that around, I think it will become a slightly more difficult to hit that criteria. And if I move on to the next example, this one was slightly more amber for us. So this was our mental health in all policies. Now, I've talked about how amazing we believe, obviously, not that we're biased, but we think our strategy is at delivering some of the mental health focus in our communities. But there's definitely things that we felt that we could do better. And this checklist sort of helped us to reassess where we were. As we have developed it in 2022, we are always ensuring that we are adapting and understanding what's happening within our systems to make sure it's updated. And this was one of the things that really helped us to stop and reflect on that point. So we have that sort of mental health in all policies approach where possible. And because we have references to it within our Health and Wellbeing Board reports, our reports for our other governance groups that sit underneath, our Being Well strategic group helps deliver our strategy for us, and we have reference to those, but we definitely think we could go slightly further with it. We also have a joint impact assessment framework, so a JIA as it's abbreviated on the slide there, which all of our council policies go through that JIA, and part of that is to ask anybody that's developing a project or a piece of work or a strategy, how are you supporting mental health needs, or how are you supporting public health needs? So that's something we've done, but we think we can take that slightly further and to sort of reach that sort of slightly different standard that the framework has. We had a named champion as part of our development work. So we've had our cabinet member of responsibility has always been our champion in this area, and we are in the process of re-establishing that at the moment because we had a change in political party. So we are kind of re-establishing that, but by having that CMR as that lead, it helps us as they chair the Health and Wellbeing Board, it helps embed them within the system, but also ensures that they're able to embed that policy in all the places that they are working and they are doing, and they become that additional outreach for the work that we're carrying forward. And we also think that we have a programme of support there for our workforce, and I'm just going through the checklist. Apologies, I'm just going through the checklist on the table there. We think we have support for our workforce, but again, we think we can go slightly further by expanding wellbeing initiatives and embedding mental health awareness in staff. So this, again, it was enabled us to sort of sit back and really reflect and think about what could we do better, and that's something we'll be picking up with our HR team moving forward. If we go to the next one, thanks, Katie. So we also wanted to also found that on CYP and developing children and young people about investing in early help mental health access points. Again, we found like there are things that we're absolutely doing, and you can see them there under that pink header, but we think we could go slightly further, and we think we can do a little bit more to really pull the strands together. So we've identified a number of different things that we've done there, and as you can see, we've got some district level initiatives, as we talked about, as being a two-tier authority, focus on resilience and wellbeing. We've also got VCSE-led detached youth provision, universal and targeted. We also have at the moment some school-based grants, so we've been working a lot with our schools across the system to support them to develop health and wellbeing initiatives within their settings, and provided some funding to help that be able to move forward and help them deliver on those, whether that's growing initiatives, whether that's physical activity opportunities, or as creating environments to support people or young people within their well-being and their mental health. And we've also developed a really strong partnership with our community safety programme. But we think that some of these strands we could do with pulling those in together into sort of those early help mental health support hubs, trying to pull some of the work that we are doing into sort of one setting, and we know that there is capacity and there is funding elsewhere in the system that we're probably not necessarily tapping into and making the most out of doing those. So if I move on to the last one, what really made this a reality, and I think hopefully that's come through in some of the things that we've picked up on, but we were really lucky that we had a really high level of stakeholder and partner engagement within the work that we did. And we had absolutely a lot of both the swell from the community within the engagement work that we did, but also within our system, having COVID-19 helped people understand just how affected mental health and wellbeing can be within sort of a change of settings. So we had really good partner engagement to do that. And we also had strong governance and leadership that fed off of that. And that was hard work to really develop it, and it took a lot of working with individuals and how we sort of got it out to the key stakeholders and work with the key stakeholders to help them see how we can kind of all bring it in together, and that really helped us sort of set the foundation and get everything through the governance structures that we needed to get them through in order to sort of get that buy-in. And by having that buy-in, we can now see how it is embedding across Worcestershire. And I think that the public engagement we did really cemented that fact. And I'm very aware that I've rattled through a lot of that. So Katie, if there's anything I've missed out, if you want to come back in, please do. And I think our director has also snuck her way onto the call, so if there's anything Lisa wants to add as well, I'll pass it over to them. So thank you, Katie.
Thanks, Lucy. No, I think you, excuse me, I think you covered it all, and I suppose it's kind of just highlighting the reflections on the framework and the checklist. We felt that it was quite clear and easy to be able to kind of demonstrate some of the examples against the reference points in the checklist. So I think that was really useful. And as Lucy said, it's all underpinned by the joint local health and wellbeing strategy, which really puts good mental health and wellbeing at the forefront. So everything kind of stems off and from that as well, which for me, I came into this kind of the local authority and it was already there, so the work had already happened. But I think that makes it much easier to get it on the agenda for a priority as well. So I can't see anyone, so I'm just going to stop sharing my screen for a minute because it's really disconcerting that I can't see anyone. There we go. Well, thank you. Any questions? Are we doing questions now, Shazana, or afterwards?
I think we'll do questions at the end. So thank you, Lucy and Katie as well. And yeah, if you do have any questions, put them in the chat, or we'll get around to the Q&A section and you can raise your virtual hand. So I love the approach that you took with the RAG rating as well. I think it's a really great way of highlighting the work that you're doing and what could be done more or better. So brilliant, thank you. I'm going to hand over to Sarah and, sorry, did I get that right? Sorry, I was on a call earlier on. My names are all over the place. Laura and Karen, sorry about that. Laura and Karen, if you're ready, then handing over to you.
No problem, thank you. I'll share the slides. Okay. You want to start, Karen?
Yeah, thank you. When I see them. Afternoon, everybody. Lovely to see some of you that I haven't seen for a long time. So that's especially nice. We've kind of taken a different tack to Lucy and Katie. Yeah, Leeds was a signatory to the Prevention Concordat many years ago, and that's very much guided our work over the years. But what I would say is that the framework's really going to help us take our work forward. So we're not really looking at the framework in terms of how we've used it so far. We're more talking about this is what we've done to date, and we want to build on that, and also in terms of where we think it's really good and where we still feel like we could strengthen it further. So that's kind of the approach that we're going to take this afternoon. So thanks very much for giving us this opportunity. Laura, do you want to just, I hesitate to say next slide, please, but that's basically.
There we go.
I mean, our approach to public mental health in Leeds is very much starts with and is built around working in communities, because we know, from the document Centre for Mental Health, but from other evidence as well, that mental health is made or broken in communities. It's about where we live, the lives we lead, what we do, the connections we make. Katie and Lucy were saying about social isolation, and the environments we live in. So the whole approach to mental health, poor mental health, needs to have social approaches as well as medical interventions. And that's for us, especially when we want to help build capacity within communities. It's not about us going in and just doing things for people in communities, but actually giving them the power to be able to make those decisions and being able to develop things for themselves. And to generate social change, it's not just about promoting mental health, but it's about generating social change for the entire conditions that people live in, and making their whole life better in their own communities. Thanks, Laura. Our public mental health programme is kind of built on three main aspects. One around reducing the risk factors, and also looking at how we increase those protective factors for good mental health. So thinking about commissioning, early intervention, and those preventative programs, and thinking about how we embed those approaches across different settings. We know about some of the risk factors, and we need to think about how we actually address those properly. Reducing inequalities, stigma and discrimination, that's a huge area of our work. We do a lot of work around trying to tackle stigma and discrimination, and all of our work is very much underpinned around reducing inequalities and promoting equity in what we do. Obviously, an important part of that is listening to the lived experience of people who face mental health challenges, and thinking about inclusive environments where we can actually talk about mental health more freely. And then our third area of work is around preventing suicide and minimising harm. So we do deliver some training. We commission training around suicide prevention. We have a post-prevention programme, and we have real-time surveillance, and we have an approach towards compassionate responses to things like suicide and self-harm. And I can't go past this without saying that we had we were very, very lucky to host the Vat of Hope on the 10th of September, and that really brought together partners from right across the city. Lucy was saying that the population of their area is 600,000. I'm not dealing in competitions. We have 800,000 across Leeds, largely in the city, but some smaller rural areas. But it's very, very diverse right across the city, and parts of the city are very different from other parts. But we came together, and it was an amazing day, and partners really, really taking on the challenge around mental health. Laura, thanks. I'm going to pass over to Laura now, because what we're actually going to do is just Laura's going to talk about a couple of different programs that we fund through the Public Health Grant. One is called Being You Leads, and one is called Unfolding. So I'm going to hand over to Laura at this point, and then I'll maybe just give some reflections around the framework itself and how it will help us, and where we could perhaps strengthen it even further.
Thanks, Karen. So yes, I'll just take a few minutes to take people through a couple of public mental health interventions that we have in Leeds, and reflect in terms of how we made them a reality, how that links to the framework. So the first one, as Karen said, is Being You Lead. So this is the public mental health approach. I think thinking of the framework, this probably fits under creating mentally healthier environments, because I know that's primarily focused on planning, but I think our job in public health is also to think about assets in communities, third spaces where people convene, how we're bringing people together to promote well-being. It could also come under prevention and early intervention, although this is focused on adults. But it's very much rooted in the evidence that mental health is made in communities, as Karen was referring to, and that if we can reduce social isolation, promote inclusion and connection, I like to think of it as being kind of an enabler to diversifying activities that are meaningful, culturally appropriate, and we know we can improve mental health. And it's a public mental health programme because its primary aim is to address mental health inequalities. So it's targeted in the 20% most economically disadvantaged areas in the city. And all the group leaders and practitioners have had mental health training. So they have the knowledge and the skills to respond to any emerging mental health needs. And you can see on the right here, it's hopefully you can see, this is the model of Being You Leads. It primarily focuses on groups and activities. So these are groups and activities that are co-produced with communities, and they're delivered in accessible venues that are welcoming, delivered evenings and weekends. So again, lots of people are able to access them, and it's about fostering those connections. And the groups and activities are so diverse. from craft groups to songwriting. We've got dance groups, and I have had the privilege of visiting quite a few, and the feedback is amazing. That kind of this going out once a week, connecting with people is having such a positive impact on people's mental health. Other elements, we've got a training delivery. Arm sounds a bit fancy really, but a training delivery part to this intervention. So as well as the staff all being trained in mental health and suicide prevention, and they also train other voluntary sector workforces to ensure that we're building capacity. Again, as Karen mentioned, stigma and discrimination. So Touchstone, who are our lead partner, they lead the Mental Health Anti-Stigma Partnership Group, which convenes statutory and voluntary sector organisations across the city to deliver work around mental health stigma. So we're currently looking at a citywide brand and campaign. We're looking at mental health literacy approaches, and also how we're promoting help seeking in communities at highest risk. And the final bit is Small Spark. So this is a small grants fund that gives people the opportunity to access a small amount of funding to set up their own group, because we know that community leaders, people in communities have the best ideas in terms of what's going to work. So that's an opportunity again to grow community capacity, thinking about some of those protective factors. One other thing I just wanted to point out was this is a 5+3 year contract, and we really pushed for this. And I know Centre for Mental Health, in previous reports, are pushing for longer term funding for public mental health interventions, because we know that reduces risk to the sector, and particularly the voluntary sector. And really importantly for this intervention, it allows those opportunities to build trust, build those relationships, allow that time to be responsive and iterative. And for us, from a public mental health perspective, really start to understand what is working so that we can continue to make the case. So I'll just on to the next slide, 1 second. So again, in the framework, it talks about like a needs assessment, and obviously that is about understanding the population, but I think it is also important to understanding what is working in terms of interventions and service delivery. And I think everyone on this call knows it is quite difficult to measure impact when it comes to public mental health interventions, but I think we're all getting better at it. And with Being You Leads, we use SWEMWebs, which is the Short, Warwick and Edinburgh Mental Wellbeing Scale. It's an academically validated tool, and there are lots of other tools. Again, would draw people's attention to the Centre for Mental Health report around the Better Mental Health Fund, which lists all the validated tools actually that you can use for public mental health interventions. But this is the best we have. It has some real positives. Sometimes it does have challenges, but we're doing lots of work in Leeds at the moment to make sure that we're using this more systematically across the system. And it's early days for us in collecting the data, but 32% of attendees saw a meaningful positive change. And I think in terms of thinking about the framework, it is about demonstrating, is it what works for public mental health? And so that's what we're trying to do, and we'll happily, we are developing some resources in Leeds which we'll happily share across the network as and when they're available. We're very brief on this one. This is another intervention that we just wanted to quickly share. So this is Unfolding. It came as a result of some of the insight from the volunteer workforce that we have in Leeds, and this was post-pandemic. It's a hugely important workforce for us in Leeds. Current estimates are that we have over 31,000 volunteers across the city. But we were gaining feedback and insight that volunteers were supporting people whose needs were growing in complexity. They're experiencing burnout, mental ill health themselves, financial stress. And we have actually seen a 25% reduction in volunteers since 2020, sadly. But we do have this we have a wider programme of work in Leeds, the Mindful Employer Network, which is about workplace wellbeing. But we wanted to pilot an approach that thinks about how we support the supporters. So we commissioned Humans Being to develop this programme, and you can see on this slide, it was about building self-esteem and confidence, giving them tools to empower others, boundary setting. Really important for us though was around a sustainable approach to work with organisations to embed wellbeing for their volunteer workforce. And we saw real positive impact. Again, we're really trying to get better at measuring impact and being able to kind of tell that story about what's working. SwemWebs was not the right tool for this. So we did actually partner with the University of Leeds to deliver a formal participatory evaluation. And it was great actually. It was with the communications department, quite innovative, used videography, and the volunteers were really involved in co-producing. But it showed that we can see here, there was improved volunteer wellbeing. Volunteers felt more able to support others and more able to set boundaries. And in terms of success factors, it's really hard, I think, isn't it, to try and think back and think about what are the kind of what's the political environment, leadership environment, financial environment that's helping you to deliver things, or what are the levers? I think when I've chatted to Karen about this, and again was referred to in the previous presentation, number one is having that strong leadership support. So our DPH is a really strong advocate for public mental health, for community development approaches and workplace wellbeing. We do have strong political support from our cabinet lead for public health and wider elected members. In fact, our councillor has visited lots of the groups and activities that are delivered by BNU Leeds. And our previous CEO at Leeds City Council was a huge supporter and wanted innovative projects as part of a pandemic response. And this is where Unfolding came from. And I think that's something that we've learned in our team, to have a list of kind of potential projects or interventions that if funding ever does become available, you have something that you can kind of submit as a business case straight away. The public health grant is a key success factor for us in that it has been identified that a portion of the grant is for public mental health interventions, which I appreciate is not the case in all areas. And again, why I think the framework is so helpful, because it is thinking, isn't it, about how we influence wider departments across the council, what we can do that's no cost, low cost. But having some funding to commission specific public mental health interventions is, of course, really helpful. And then again, I've talked about this a lot, but making the case. How do we present the evidence base? How do we link with key academic partners to, again, grow the evidence base around public mental health? Again, we're looking, Leeds, we've got 6 universities in total. But again, I think there are lots of opportunities for public health teams to work in close collaboration with academic institutions. So that's it from me, and I'll hand over to Karen for final comments.
Thanks, Laura. I suppose that the bottom line for us, we really, really welcome the framework for a number of reasons, really. It does really help us embed our health promotion work, but also like that primary prevention. A lot of people are talking about prevention at the moment, but it's not always in the sense of, like, it's certainly for us in public health, it's about primary prevention. It's about keeping people well, physically and mentally, so that they don't have to, fall into the demand for services. So thinking about that early intervention, thinking about local policies and services, it helps us embed all of that. So we really, really welcome the framework. It also helps us to benchmark. We're quite lucky in within West Yorkshire, because Leeds being such a big place, we do have resource that we can put into that. And as Laura's already said, I recognise that many public health teams are very, very small and don't have that benefit of the resource to be able to target it into public mental health. But it helps us benchmark our current programme. So, if you've only got a limited amount of resource, where are you best putting that it will have the biggest impact? So thinking about that for both public health and wider local authority departments, but also to help us think about where our potential gaps are. We were moved into, public health was moved back to local authorities in 2013, and that's where we need to be. But sometimes we forget about why we're actually there. And I think just having that Mentally Healthy Councils framework, it does show leadership in promoting public mental health is a priority issue. I was also reflecting on, well, what do I think also needs to be in there in terms of making it, the framework even stronger? And I suppose for me, it's really much more about more emphasis on prevention and early intervention. But not only that, but thinking about the evidence base, the costed evidence base of what works. We know that workplace wellbeing initiatives work. That's why we've invested in it. Suicide prevention, we invest in that around postvention and surveillance. Befriending, for example, you know, what's the evidence base of that helping around public mental health? So thinking about how we build that potential investment in communities, you know, what works would be really, really helpful. And I suppose for us in Leeds as well, it's thinking about, we really need a strong call for action around a local authority's role. And that's for all local authorities in tackling not only poverty and inequality, but thinking about racism, discrimination and stigma around mental health, and the wider impacts on poor mental health. So the framework is great, but I think those are the areas where I think, and we think in our team, that it could still be strengthened further. But I see this framework as an iterative process that we, you know, as we work through it, we'll be able to build on that. So I think it's a wonderful start, and really pleased that it's being launched today. So I'll leave it there. Thanks.
Thank you, Karen and Lauren. Your insights have been brilliant. We are pushed for time, so I'm going to hand straight over to Kadra. And if there are any questions, please do add them in the chat, and then we can go through them a little bit after. So Kadra, over to you.
Thanks, Shazana. Can you see my slide?
Yes, yeah, we can.
Oops. Sorry, good afternoon, everyone. Thanks, Shazana. And yeah, really great to hear from colleagues. So I've been asked to just give you a quick overview of the Big Mental Health Report 2025, which is hot off the press. We published this last week in partnership with Mind. So what is the Big Mental Health Report? This is an annual collaboration which we launched for the first time last year. And the report essentially brings together Mind's large-scale research with the general public through their Big Mental Health survey, as well as a survey they produce on attitudes to mental illness. And we supplement this with our Centre for Mental Health Policy Research and Systems Analysis. And together, really, our aim is to help paint a clear picture of the state of mental health across the UK, what's improving, what's getting worse, and what needs urgent attention. And we'll be reviewing this on an annual basis to help track national progress and also use it as a tool to hold the government to account. It's also very much for us about connecting that national evidence with local possibilities. And so we hope that some of the insights and trends are useful to you all as council leads in your strategic planning, commissioning, and any other conversations you might have. So the report pulls together all of the latest evidence around the current state of mental health. And it shows, unsurprisingly, that mental health problems remain really widespread. Around 1 in 5 adults report a common mental health problem, according to the adult prevalence survey that came out over the summer. And we already know that children and young people report a similar rate too. This chapter also brings together wider prevalence data, including around issues related to self-harm, suicide risk, mental illness, and other factors that interplay with mental health, such as
I don't know if it's me or if we've lost Kadra. Can anybody hear me?
Yeah,
I thought it was me as well.
Oh,
I think
so
we've
it's
lost
Kadra.
her. Yeah.
Okay, we'll just give her a minute to get back. She has all the slides, so I wouldn't be able to speak about this. If we do, maybe we'll just go to some questions if whilst we're waiting for Kadra to get back. So if anybody does have any questions, yeah, please raise your virtual hand. I see one up at the moment. I'll add them into the chat. That'd be great. Graham, I think I'll open up the floor to you then. Lovely to see you here.
Thanks very much. Thank you. And thanks to Laura, Karen, Katie and Lucy. And your work looks amazing. And I can see a real strong theme of public mental health approach. And I just think that there are some key aspects to that. The idea of focusing on prevention, tackling disadvantage, health and all policies, you know, that sort of proportionate universalism. So, you know, help for all, but tailored to need. Evidence-based and, you know, reviewing progress and measuring success. I think some of these are the real key themes running through all of this work. And I think it's helpful to bring that out. And the other thing I was really struck with was around the asset-based community development. And I was fortunate enough to speak to Professor Lisa McNally just the other week about this. The DPH at Worcestershire, and she was talking about some of the programs around asset-based community development and the incredible outcomes that they're seeing there. So just wanted to encourage you to kind of ask us all to think about this public mental health approach and how we can get into our communities to really unlock their potential to enable their communities to thrive. Thanks.
Thank you, Graham. Really great to have your input into this as well. Thank you. If anybody else has any questions or reflections or anything they'd want to share. Lisa's put in the chat. Okay, I'm getting a bit of feedback from Lisa. Do you want to come in? Right,
yeah. Thank you for the shout out, Graham. I was equally impressed by your work in Wandsworth there, London. So thank you. Absolutely great stuff you're doing as well. I just wanted to ask us all a question, really, pose a question, because this tool that the Centre for Mental Health produces is incredibly helpful. It allows us to some degree quantify how we're getting on and to be able to compare progress over time across areas. I think it's absolutely invaluable, especially at a time when local authorities, which most of us are in, are facing the most extreme financial pressures. Many county councils in particular are on the point of a Section 114, on bankruptcy. And so how do those of us interested in public mental health make the case to our organisations and indeed NHS? I've not been that impressed, I'll admit, recently with some of the, policy developments around mental health in the NHS, or sometimes lack of policy developments. And how do we constantly make that link between better public mental health and better financial well-being, both in terms of the organisation but also the wider community? I mean, an obvious one is work and health. I think our colleagues from Leeds mentioned, health at work and mental health at work, and obviously there's a clear link there with absenteeism and the bottom line for companies. How else can we do that? Is that really the key, I suppose I'm asking?
Does anybody want to come in here? Anyone has any thoughts on that? Lisa, thanks for asking the question, and also thanks for making the time to come in. I know you've had a really, really busy day. Karen, you've got your hand up.
Yeah, we haven't got much time, so I'd love to talk to Lisa at some point in more detail around that. I think we just have to frame it in terms of the economic, the social, and the emotional ways that we actually benefit communities, which if you benefit communities, you'll have more social cohesion, you'll get people into work, or the reduce absenteeism. There's a whole list of things that we do, but we have to sell it in terms of how they feel that it will save them money in the longer term. That's a narrative that's only a narrative that local authorities are interested in the moment, if I'm being blunt. So it's thinking about how do we use that narrative to say this is a good investment. You know, we talk about invest to save, but this is where you can save, you know, lots and lots if you do it in those terms, as well as obviously being really, you know, good for communities. But I'm more than happy to chat later, Lisa, if you want to.
That'd be great. Yeah, I think I agree.
Thank you. I think Kedra, are you back?
Yeah, I am, and I don't know what
back.
happened. Did I drop off? I was literally talking to myself.
Were you carrying on presenting?
Yeah.
Until you noticed my message.
Oh, okay. Sorry, I didn't see the message.
We
Oh,
lost
did
you.
you? Oh,
We
how
lost you
embarrassing.
at the point where you were talking. I think you presented a couple of slides. Do you want? You've got a couple of minutes if you want to come back.
You know what? Don't worry. I think what we can do is just maybe circulate the slides and a link to the report. Sorry about that, because I just kept getting messages popped up and then I couldn't really see my screen. So.
It's all right. It's all right. Welcome back.
All right.
You might be able to answer this question actually, because I think we have spoken about it, but we've got one question in the chat. Does the framework look at the internal council needs with regards to mental health? Given the pressures that LA's local authorities and the staff are facing, do more for less. How do we ensure non-burnout there in order to be able to support the communities? Kedra, I might hand that over to you.
Yeah, no, I don't think we've, thanks Jamie for the question. I don't think we've delved into it that deep, to be honest. I think our approach around co-developing this with the network is to test and understand and explore where there might be some challenges. So yeah, it's not something we've come across so far, but I can definitely see how that's an issue and something we'd be quite keen to learn together around.
Thanks, Kedra. Rebecca, I see you've raised your hand. Do you have a question to ask?
Yeah, no,
reflection.
Thanks, Shosanna, much appreciated. No, it was really to follow on from what Lisa was saying, actually, because I think that is one of the key questions and why I'm absolutely delighted that the Centre for Mental Health has set up this forum, actually, because I really see it as as possibly an opportunity for us to think about those big strategic questions. I am in an adult mental health integrated commissioning team in Greenwich, just by way of background, but I think that it's not unreasonable for state money to be scrutinised. So it's not unreasonable for us in local authorities to have to think about whether the money that we're spending has actually helped to maintain independence for a person, or indeed enhanced their independence. And it feels like we probably ought to be doing a little bit better at articulating that. And when it comes to funders, whether that's government or, you know, whomever it is, there's something to think about. There's so many local authorities, and it's difficult for them to have to interact with, you know, 300 odd teams, or, you know, whatever the number is. So there is possibly something in the kind of medium to long term. How do we do better to have the same narrative in terms of what has been successful about state intervention, and therefore make it easier for them to fund us. I know in Greenwich, just to finish, as I am sure is the case for most local authorities, the vast bulk of our system budget is spent on a very small number of people with significant acute needs. And of course, we should support them. But how do we think about genuinely supporting those people at an earlier stage in their crisis journey, so that we can potentially help a wider group of people, or make the money work harder. So yes, we really think it's a fantastic question, Lisa. Love this forum. Would love us to keep talking about that, so that we can be more effective and do more for more people.
Brilliant. Thanks, Rebecca. It's really good to hear that, and thanks for sharing your insights. If anybody has anything to comment back to that, then I'm going to go to Joseph for one final question, and then to Andy to start closing. So yeah, Joseph.
Yeah, first time being part of this group, and I've loved being part of it. I'm service lead for mental health and wellbeing at Birmingham City Council, so nice and close to Worcestershire with Lisa. Love the fact that we're all using the same language, and it's really striking me how we're talking about the same things. I've really liked the point about primary prevention. I've heard prevention being discussed a lot, but that tending to be more of that early intervention and secondary prevention space. So nice to have some allies who agree with what we're trying to do in Birmingham, and help people before mental illness develops. I think going back to Lisa's initial question on kind of how we justify ourselves, and how we can do this in the face of financial adversity, particularly Birmingham with our 114, which is quite widely known. It is definitely a challenge. I think workplaces are key. I think that was a good thing to touch upon. In Birmingham, we're really fortunate. We have such a large number of assets within the community. We've got a big VCFSE presence, but I think what we can probably do more is help them to capture the range of outcomes a little bit better, and show impact a bit more strongly. We use WebWebs quite a lot. I think there's probably a number of different variety of validated tools that we could get them to use that link to different outcomes that we're trying to achieve. We also might want to think about being creative and innovative with addressing health inequalities, because we know that some communities don't want to fill in surveys, and there's a lack of trust, a lack of representation within surveys. So maybe we've got to be a bit more creative. I don't know, things like comic book strips or short videos or things like that, so that we can measure impact and justify that a little bit more. That's just my thoughts anyway.
Brilliant. Thanks, Josie. Thanks for sharing that as well. Really good. Just short on time, so I'm going to quickly hand over to Andy for his reflections. Andy, are you here?
Yeah, hello.
Oh,
can you see
hello.
me? And indeed, well, hopefully you can hear me. If you said hello, that's positive.
I can see you now, yeah. Mm-hmm.
First of all, massive thanks to everyone who's in this community. It's such a joy to be part of, and spending time with you is an absolute privilege. So massive thanks to all. It's been wonderful to hear from Laura, Karen, Lucy and Katie just now about the amazing work you're doing. Very brief thoughts. First of all, I think we've heard so much about the importance of a systemic approach to the public's mental health, something that we all own, and both having that kind of made in communities approach, but also dealing with the big stuff, not being afraid to deal with the big, important social and economic things that make a difference. The importance of having a strategy and having really good leadership to get people together and battle stigma. We haven't won the battle on stigma. When you have a look at the stuff in the big mental health report, you'll see that laid out very clearly and quite painfully. I think some really exciting discussions about the mental health impact assessment and policies. We'd love to know more about different ways in which councils across the country are trying to do that. I think there's some really interesting approaches coming out, and great to hear about that today. Good to hear about the importance of community assets and valuing community assets, really accentuating the positives. That actually this is a great opportunity to make life better for people by doing the positive things that are going to create good mental health. It's just wonderful. I love the approach to being deliberate about reducing inequalities, not leaving it to chance, and realizing that trust has to be built. It doesn't just happen. The question about measuring change, thank you for the challenge, Karen, on that. I think one of the things we really need to think about as the host of this network is how we can link you up with one another to find out what you're doing, learn from the evidence. All the things that we could possibly want to do are being done somewhere. So let's learn from that, and let's create learning opportunities together and find out together what works. I'd love to know more about how local areas are transcending political changes in political leadership, and how we can support you as public health folk predominantly through those changes of political leadership, so that progress is sustained no matter what happens with the kind of democratic control of local authorities. But most importantly, I just want to say a massive thanks to all of you for your collective wisdom, experience and commitment. What a wonderful, wonderful group of people you are. Andrew.
Thank you, Andy, and thanks for coming to join us. We know you're a busy man and wherever you are in the country.
I'm on a park bench next to the Euston Road, and there were lots of ambulances coming past while other people were speaking. Thank goodness they haven't while I've been doing this, otherwise it would have been a terrible screeching noise as well as the drone of my voice.
Oh, we really appreciate you joining us, so thank you. A final thank you from me as well to Lucy, Katie, Laura and Karen for your insights. This has been really, really helpful, and I hope everybody else has found it really, really helpful as well. Like I said, we'll be sharing everything in the digital goodie bag that will come out, and there'll be a form to fill out as well if you don't mind. This helps us to just deliver our webinars a little bit better each time. And if there's anything you want to share with me, if there's any feedback you want to give us personally around the framework, then please do drop me an email. I think I'll send you all an email anyway after this. So apologies for Kadra dropping off. That's absolutely fine, Kadra. Are there any plans for the next session? Yes, there will be. That we are having another, hopefully towards the end of the year, we'll be doing another webinar, another session, not like this. This will be something that we will do again when we officially launch the new framework. After using the learnings from today, we'll redraft it all and do a final published version of it early next year, hopefully. But we will have another session before we break up for Christmas as a webinar. So thank you everybody for joining us. Sorry we're running a little bit late, but please do enjoy the rest of your day. Thank you.
Thanks everyone.
Thanks all.
Thank you all. Take care.
Take care. Bye bye.